we're going to have a good, honest discussion about some of these topics that you see behind me. But before we get into that, I just wanted to give you a little introduction about myself. I've been in public education over 29 years. I was a teacher, instructional leader, assistant principal of instruction, and then I led a large urban high school in a school division in Hampton, Virginia for 7 years. I was a high school principal when I was 34 years old. My superintendent tapped me on the shoulder and said, "You are it. Here you go. It's yours." I had a great experience there. I absolutely loved where I was at. I had great athletics. Alan Iverson, that was his home school. So on a certain occasions, he would call me up and say, "I want to come to the gym for a couple hours." So I really had an amazing experience there. But now I've shifted into the facility management realm because I had so many issues in an aging building that I just felt almost helpless at times with things that were happening in classrooms, with roof leaks and AC not working and kids getting frustrated and teachers getting frustrated. So in 2009, I finished my PhD at Virginia Tech, and my dissertation and research was on adverse school building conditions and the influence on school building, or the influence on academic achievement, student behavior, and student attitude. So, and I found after that research, I did a meta-analysis that there was a 3 to 5% variance of academic performance in schools that were adverse. So my expertise, I'm not an architect and I'm not an engineer. I'm a practitioner and I'm a researcher. So I've got that common knowledge of what I think should be happening in a school, and I just had a strong passion for the environments that kids and staff work in. So with that being said, I did a lot of research, and I've been director of Chesapeake Public Schools for now 10 years, and I've been the CEO executive director for the National School Plant Management for over a year and a half. Before I get into this, I wanted, and I haven't heard this from anybody today, but those of you that are active in schools, I have to thank you for everything that you have done for what has happened in the last year and a half. Without us, we would have not had these schools prepared, kids to come back, teachers to be back, and we're still dealing with it. And that's why I wanted to talk about some of these things. But without you guys and what we do, it does take all of us, in food services, transportation, maintenance, and operations to make this happen for our kids. But again, it's been a tough year, and we should all acknowledge that. And even though it's been tough, I mean, we have persevered and made it through. And I mean, I had some tragic things happen earlier on. I lost staff in my school division, and in my shop, I oversee about 100 people that I did not get to say goodbye to. And it was earlier on in the pandemic where when people passed, there was no gathering. You couldn't do a funeral and things like that. So it's very personal for me, but I just, again, want to thank all of you for what we've done. We've built sneeze guards, temperature checkers. I mean, we have done anything and everything through indoor air quality. And again, it's been a lot, but we've made it through it. And hopefully we're going to be on the better side of this coming up. So keep your heads up, and we will get through it. But we still got things going on, don't we? I mean, every day, and that's why the disgruntled people is going to be the last thing I talk about in mental health. But the mask and the vaccine, we're out there. Do I get it? What's our policy for masks? I know where I'm at. It's still very controversial. I've had to discipline staff because they don't want to wear a mask in the building. Our school board has governed a policy that we will wear a mask actively. Our kids will wear a mask, and it's caused issues in schools. So that has been a tumultuous thing for us. Something as simple as protecting your own personal health, but there are varied philosophies on that. And the same thing with the vaccine. I know many of us in our school divisions, we are essential personnel, so we were offered that vaccine quickly. And most of our staff have gotten it. But I've also seen in my region that those that didn't want to get it, it's not a mandate or mandatory, that we're still getting people sick. I even had an outbreak in one of my shops where I had 5 guys contracted that, and I can't ask them. You can't ask. You know, we just try to advise and communicate effectively to make sure that we're giving the proper education, letting them know the effects not only on their own personal health, but we walk that fine line. That is a very fine line of personal preference and things like that. But is anybody, and I can't see you guys too well, and I want this to be a little interactive. Does anybody else have mask mandates? Are there flexible devices in schools? John, I can see you back there.
Albuquerque has mask mandates, and we have a mandate for all workers for vaccines. And if you're not vaccinated, you have to test every day. Every week.
Wow.
Once a week.
Okay. Any other states?
Colorado, full mask in the classroom.
Full mask.
K through 12.
Okay.
Now we do ask everybody throughout the district. We did a poll, and we're still 400 employees short of getting responses, but a large part of them responded.
Really?
To it. I mean, you know, I think the toughest thing that we're going to be faced with is if there is a vaccination mandate that comes out. We, you know, it's transportation, it's nutritional services, it's the operation side of the house, the custodial, that are the largest part of the groups that have not been vaccinated and don't plan on it. You know, I tell you, you got to educate your school board because we could lose 20% of that workforce, and we will not be transporting, we will not be cleaning the buildings effectively, and we won't be feeding kids.
So are we all facing the shortages now? You can't get
You're
much
already,
right.
you can't
That's
hire
right.
anyone now, and it's
So
still lose another 20%.
And that's exactly walking that fine. But it's very interesting to hear about, you know, in my state in Virginia, there is we cannot ask. Human Resources has told us, do not ask your personnel if they want to discuss it with you as a personal, you know, option or a preference. You can have those discussions if they initiate the contact. But it really makes it difficult because, I mean, you could have people walking around sick that it scares you to death because in my shop, these guys have seen, again, people pass away from this. So, you know, it's very interesting. Is there anybody else that...
John?
Okay, I can't see you.
Oh, yeah. Hey,
okay.
John, Memphis, Shelby County. So, local health board issued a mask mandate.
They did.
It was required in schools.
Anything with vaccines?
Nothing with vaccines at this point. However, the state of Tennessee then came back and recently passed legislation to remove the authority from the local health boards to initiate a mask mandate. So
really?
we've gone both ways.
Very interesting. Okay.
Baltimore too, John.
Okay.
So in Maryland, we had it was LEA by LEA for mask mandates, and there were 2 that chose not to, and the state government jumped in and said they had to.
They have to. Yeah.
All schools have to be masked, including staff in the offices. Baltimore City has a vaccine mandate, and if you weren't vaccinated by November 1st, fully vaccinated, you lost your job.
Yeah. Well, and you see what's happening in the private sector. I mean, if you're over 100 employees, they're mandating it. Where I'm at in Virginia, we have a large shipyard. We have the largest naval base in the world, and that's what it's coming to. I don't know if it'll come to a mandate across the country for us, but it's still something. It's a big concern for the health of everybody. Now, the other piece, so I'm going to move away from that, is indoor air quality. And I tell you, we all probably, if we work in a school division in facilities, we all pretty much probably feel like we're experts in this. I mean, I know everything from electrostatic precipitators to needlepoint, you know, bipolar, UVC, HEPA filter with the UVC, entry into the ducts. I mean, we all know it. And I get asked all the time. This is the $100 million question I get asked because I'm in a front position for the country, and they're like, "What should we do? What is the best choice?" And you know what I tell them? Choose what's best for you in your school division. Do your research, because there are emerging technologies. Some are better than others. Some have ozone requirements. So you have to really look at what is best for you. And pay attention to the ASHRAE standards. What is ASHRAE saying for introduction of outside air and what we require? Test your dampers. Now I'm going to tell you, here's what I've done in my school division. So I've researched everything, and my superintendent, and I know I have Johnson Controls. I think I don't know if Pandemic Solutions is in here. I can't see you, but I know you're in here. Okay, thanks for that. So I mean, Atmosair, and there's a bipolar fraction there, and then Johnson Controls does a HEPA filter UVC product that they market, and so my superintendent was like, do we really need all this? And I'm like, I'm going to do what you asked me to do. I'm going to provide you with the information if you ask me for it, and then you're going to make the decision. The school board is going to make the decision. There's a lot of this, just like these. I mean, I made glass shields. I mean, I engineered, design. I have a full carpentry crew. We made our own. A lot of this is perception. So what actually works and what is actually the perception of what we think is going to keep everybody safer when they visibly see it. So it's a big thing there. So what my superintendent said, he's like, listen, he goes, if I know the buildings are safe and I think we're just going to hold tight, we're not going to do anything. And I said, well, we can look at what ASHRAE says, and if we commission our equipment and I have it analyzed, and they tell me we're meeting all the specs for the ASHRAE standards, then that's what we'll go with. And if the school board comes back and they haven't, so that's what we've done. I did a big partnership with Johnson Controls just on my preventative maintenance. I did filter changes. We're doing some now every 2 months, so they're moving them through. We heard some things on MERV 13 filters. So you need to know the facts on that. They say MERV 13. If you put a MERV 13 filter in a 40-year-old piece of equipment, the static pressure that you're going to put on that aging equipment is going to cause more damage in the future than it does. So you have to look at the manufacturer specifications of your equipment and then choose and make the right decisions for that. If you have newer equipment or you're phasing stuff in, a lot of you are doing multi-million-dollar capital improvements, then absolutely design the spec to have that MERV 13 or higher filter in there with the induction of outdoor air with a damper system, depending on what you choose. There's VRF, there's all sorts of stuff that you can do now. Then choose that, what's best for you. But just note that, because I hear that all the time. Oh, they said MERV 13, we got to do it. And I'm like, and then my counterparts in the other school divisions are calling me. They're like going, man, I'm having all sorts of problems with the equipment. And I'm like, well, have you looked at your design features for that piece of equipment? Well, we didn't think about that. They just said put them in. No. And there you go. So just be cognizant. We want to have these open and honest discussions about this stuff, about what is recommended, what is required, and the long-term effects on some of these things. Okay, last couple minutes. I've got about 7 minutes left. I want to talk about disgruntled people and mental health of our kids and our staff. Because I'm going to tell you, you watch in your school board meetings, they've lost their damn minds. I mean, they literally have lost their mind. And it's unbelievable. I was at, I have to go to some of my school board meetings, but I didn't go to this one, but I watched it on TV. I had a state delegate that came in that was upset with one of our school board members and got so irate that the police had to restrain her, handcuff her on TV, put the cuffs on her and escort her out and charge her. So you can imagine, this is your leadership for your county, for your city, and then parents and all that. You know what? We want to have transparency. You want to have transparency. You want people to be able to discuss issues with you in a reasonable way. But today's society, it is open door to say what you want to do what you want to do, and we've got to regain that civility back in our society. So you see that all the time, and we've seen it with our staff and our teachers. I'm not coming to work to teach in that classroom until you do this, okay? Then we have to come to some resolution or some mediation in between to meet halfway, because what we're going to do and your perception of what you think is the best thing to do are two different things. So that piece, I know you're all dealing with your school boards. I know you guys are, because you can see it every meeting. It's not getting better. There's all sorts of stuff from LGBT to the indoor air quality to wearing the mask to distance learning. I'm not going to have my kid in that school. But what has happened in your school divisions? Are you seeing what I'm seeing in Virginia? I can't see you, so if you yell.
Yeah.
Hey, John.
Yeah, Jeremy.
Here. Real quick story. I live in a different district than I work in. And the district that I live in, my wife's a teacher there, my kids go to those schools. They just went out for a bond, a $772 million bond. That bond failed by 200 votes. And the reason that it failed was because of the issues going on with our community and our school board. Disagreement on curriculum and provocative books. And they made a statement, right? So their voice was very loud. We asked them a question and they answered. So now all of a sudden, these issues that we're seeing are impacting our facilities. They still need to build schools, they still need to renovate schools, and they still need to bring new technology to the campuses. So indirectly, they're affecting our jobs in essence.
And the learning environments we're trying to sustain to make sure kids have the best environment to learn. And it's sad, but it's just what's happening in today's society. How about anybody else? That Jeremy from Texas. Any other states going through anything that you guys want to talk about? Can't see you.
It's Karen here. So we don't have a school board exactly, but we've had lots of forums for parent feedback. And one of the things that has happened is we've started getting these floods of emails. So I regularly would get emails, all caps, why are you suffocating my child? Why are you killing children?
Yeah.
And that was, everyone, the chancellor would get them, all the deputies would get them. And in the parent feedback sessions, we would essentially get similar questions and statements. So very challenging.
Okay, great. Okay, I've got, again, a couple minutes. So the last piece I want to talk about is the mental health of our staff and our students. Over the past year and a half, again, researcher and practitioner and a people whisperer, I look at these things. I'm curious all the time. I want to know if we're doing the right things, talking to everybody. And mental health has been an awful thing. The desocialization of children in this environment has really affected them. You've seen suicide rates go up tremendously. And one of the things that I've seen just through some of my research is suicide rate is one thing, but malnutrition and not eating properly. I mean, kids losing tremendous amounts of weight because they're staying in that environment. They're not being, engaged. So you have kids that have depression and things like that are happening on. So I know we deal with facilities, but just be cognizant because that rolls over to us. I employ 100 staff, 100 technicians. I have 8 office staff, account clerks, and things like that. And I've had a couple that have come to me to say, I've got these feelings and stuff like that. And that's where, you want to involve, some risk management folks and some other things like that with your consult services for your health services. And we communicate effectively with those staff to provide support. You have to provide the support. Be a good listener, be understanding, and then help them. If you turn a blind eye or say, you know what, you're 35 years old, you're going to work it out. You're a grown man. You're going to work it out. That's not the right answer. You need to get them the services, talk to them with health services, get them on the phone for employee assistance, get them to be asked, are you requesting, do you require employee assistance? Because if you turn a blind eye and somebody in your shop, something happens and somebody knows that you did nothing, just be careful. You don't want to become liable where you did not act, where that could have been a situation where you should have referred to some services. Okay, so I've got a minute left. Anybody have anything else they want to discuss with other things that maybe we didn't talk about or any questions before I close?
I want to know how we can work together to get that infrastructure funding.
Well, that's why I brought my question up down here. It's great to know those statistics, but you know what? There is a national association. We have it. link in with me, follow us. K12, Michael does a great job on what they do on LinkedIn. Get involved. I've been on so many webinars with them. I've been in a panel with them. Get involved. That's what we have to do. And maybe some of these, researchers that are doing statistical analysis, maybe they need a Jeremy and they need a Clarence or a me, a John, to get up there and punch some people in the face. Because if you don't do that, if you're not assertive and you don't really, I'm going to tone them up a bit. If you don't really make them understand what the negligence and then not supporting us with these buildings is doing to the academic and the physical environment of our schools, nothing is going to happen. John?
I think just real quick, until we tie in the academic success or the lack of academic success because of poor buildings, I think it's going to be hard for school boards to link the two because there's so many of them that are. A lot of boards are just common. I mean, they're not professionals in this level of education or facility, and until they can link the two together, it's just thinking we're throwing money on a building. We need to throw it at education, and I don't know how that.
It's all correlated, John. It's completely all correlated.
Right.
But here's the thing: these other groups that are doing statistical, and listen, I'm a researcher. I know that. I've done regression analysis. I know exactly what he's talking about. You have to make it humanistic. You have to make it relevant. I can talk numbers all day. We all know we don't have no money. We all know it. There's no money. Some school divisions, you can't get a bond referendum. You can't do performance contracting because of the debts. We know this. You guys have been in this role. Okay, fine. Then what are the other avenues to do the work we need to do? Cooperative purchasing. You had Liz here from Sourcewell. It's an avenue to eliminate bids and RFPs for certain services, as we spoke earlier. You've got to be creative. But there needs probably some of us to be in these groups, in these target groups that can share the voice, that can share some of these other pieces that they're missing to make a positive influence, to sway the decision-making here. And I know I'm over my time. So thank you all very much for engaging.